Welcome to Anatomy Coloring Book, page 40. This is Dr. Stephen Harkins. In this lesson, we are discussing the ankle joint and bones of the foot. We've already discussed the lower leg, including the tibia with a medial malleolus, which connects to which has a joint, shares a joint there with the fibula called the distal tibiofibular joint right here. And the tibia and the fibula combined create this area, this crural joint here. And it provides the sort of roof or the ceiling for the ankle joint, the combination of the tibia and the fibula. This bone underneath the tibia and the fibula is called the talus. And it is an important joint. You can see down here at the bottom here, it's sort of dome-shaped. And you can see how this joint slides, there's a sliding effect that occurs, this talus bone right in here, as these movements occur around the joint. As you lift up your ankle and go down, you can see this dome-shaped talus allows for sort of this sliding motion of dorsiflexion, which is toes up and ankle up, and plantar flexion with the ankle down. So the talus lies deep inside there, and it allows for that hinge-like motion. It's like a U shape. If you look over here, it's an inverted U shape that is created by the tibia and the fibula, and the talus fits right in there and allows that hinging motion. So it is a hinge type synovial joint. The talocrural joint. The foot is divided classically into 3 sections. Those 3 sections are as follows: the hind foot, midfoot, and forefoot. The hind foot consists of 2 bones. It consists of the calcaneus, and this is the bottom of the foot, by the way. This is the plantar view of the foot, the plantar surface of the foot. And it consists of the calcaneus here, yes, the calcaneus, and the talus. The talus is kind of hiding. Remember, we're looking at the bottom of the foot here. And there's a little bit of the talus peeking out around here as well. That's considered the hind foot. The midfoot consists of, this is the bottom again, the navicular bone, the cuboid bone, and these 3 bones here called the cuneiforms. The cuneiforms right here. So we got the navicular, cuboid, and the cuneiforms. The medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. The midfoot. Lastly, the forefoot consists of these 5 metatarsals. So this is the forefoot. These bones are the midfoot. And these 2 consist of the, or make up the hind foot. Now, metatarsals and phalanges. The metatarsals are these large, sort of long bones of the foot, you could say. With these little sesamoid bones on top of them, like the patella, those little round bones there. This is the first metatarsal. Remember, we're looking at the bottom of the foot. This is your big toe right here. And we're looking at the bottom of the foot. So these long bones are called metatarsals. And then beyond the metatarsals, we have what are called the phalanges. So that's the first metatarsal, second, third, fourth, and fifth. These are the phalanges right here. These sort of your toe, which you would commonly think of as your toe bones. The end of the toes. And these are called, so this is your proximal phalanx or phalange, the middle, and the distal. And you can see why proximal is closer here to the center of the body. And the distal are the ones that are farthest away. So in an intermediate phalange, distal phalanges, or phalanx. Notice that the big toe does not have a distal phalanx. It only has two. It doesn't have an intermediate, you'd say. It has a proximal and a distal. And of course, this is considered the base of the phalange here and the head of the phalange here. Now let's look at it from the top view, starting with the hind foot. We have the talus. This is the head of the talus, or the right here. The head of the talus here with the dome of the talus on top. Remember, this is the top. Underneath it, we have the calcaneus here. Calcaneus is your heel bone. It's that big weight-bearing bone that you stand on and you put all your weight on. Now, the midfoot. Midfoot, recall, contains we're looking at the top, and this is the medial side of your foot. This is the medial side, and this is the lateral side. Medial, lateral. Inside your foot, outside your foot. And on the inside of your foot, we have this, what's called the navicular bone. Here. And then over on the side of your foot, on the lateral side of your foot, we have this cuboid bone. And then remember these three right here, 1, 2, 3. Now the top view, the cuneiforms. Cuneiform medial, because it's on the medial side. Intermediate cuneiform, because it's in the middle. And the lateral cuneiform. And that's your midfoot. Now, the forefoot, right here. Foot contains these 5 metatarsals and 14 phalanges. Here's your big toe. It's your metatarsal number 1, metatarsal number 2, metatarsal number 3, metatarsal number 4, metatarsal number 5. And then distal to them are the phalanges. Phalange number 1, proximal, distal. Proximal phalange, intermediate phalange, distal phalange of number 2. Proximal, medial or intermediate, and distal. Proximal, intermediate, distal, proximal, intermediate, distal. Recall that the big toe does not have an intermediate phalange, and this is the forefoot. Oops. The forefoot. Now let's look at the foot from behind. Of course, you have your calcaneus. This is your heel bone. Mixed in here somewhere This is the dome of the talus right here. This is the talus bone right here. And that's a ligament cut off. So from bottom up, now you can see that the calcaneus rests underneath the talus. And the calcaneus, the heel bone, holds up this talus bone. And you can see, of course, the crural joint with the tibia here. And the fibula here. And you can see how it makes this, actually the makes this crural joint here. Nice on upside down U shape for the talus to rest in. In another view here, side view, we have the calcaneus here. With the talus on top of it. Let's see if we can define this talus here on top. You can see the fibula here on the side. This is the lateral view. You can kind of see the tibia over here on this side. Okay, so here's your hind foot. Right. You can see now since this is the lateral side, you can see the midfoot, you can see the cuboid bone, right? Find it over here again, the cuboid bone, here and here. You can see the navicular bone right here on top. Really, it is the top of your foot, the classic top of the foot bone. If you tie your shoes too tight, you might feel it right on top of that calcaneus. And you can see two of the cuneiforms, the intermediate and the lateral and the intermediate cuneiforms. And then moving on, that's your midfoot. And you can see the bones of the forefoot, fifth metatarsal on the outside here, right? Fourth metatarsal, third metatarsal, and then you see your phalanges. Again, this is the forefoot, and this is called the midfoot, right? And these, while we're looking at it, these bones of the hind foot, midfoot, and forefoot constitute the lateral longitudinal arch on the outside of the foot. A very subtle arch that exists on the outside of your foot, created by this cuneiform, by the calcaneus, by the fifth metatarsal. Creates something called the lateral longitudinal arch. If you were to look at from the forward, there's also a transverse arch from the front view with the three cuneiforms and the cuboid bone. They form a transverse arch. From the posterior anterior view, you can't see it here, but from the front of the foot, it would look something like that. Now, the medial longitudinal arch is the one we've heard most about. And let's define the parts of the foot first. Here we have, this is the medial view, or from the inside of your foot. You see the calcaneus back here. It's covered by ligaments and muscles and things like that. And this is your hind foot, obviously, and the dome of your talus would be something like this here, right? This here. And so this is your hind foot. And then we have here your navicular bone. And then your first cuneiform. And your intermediate cuneiform. And of course, over on this other side back here, which we can't see, is the cuboid bone. cuboid. And lastly, so that's the midfoot. Lastly, the forefoot. We have, of course, the metatarsal. That's the first metatarsal. And here's the first proximal phalanx and distal phalanx of the big toe. And those little sesamoid bones I talked about, those little round bones are found at the bottom of your foot that help with leverage and the pulley system to pull the tendons run through there, and it helps the pull of and the sliding of the tendons on the bottom of the foot. And of course, the arch created by all these bones from the length of your foot from here to here is called the medial longitudinal arch. So you got to think in 3 dimensions here. There's the medial longitudinal arch, and if you're looking from the front, the transverse arch, and then from the side, the opposite side, the lateral longitudinal arch. I think it would be useful to go over some of the bones of the hind foot and midfoot each in their own, and give each bone its own color. So let's start out with the calcaneus here. We'll make it purple here. This bone right here. Although I'm sure you've got it. We'll make the talus in blue. The head of the talus, the neck of the talus, the dome of the talus. And the navicular we'll do in light blue here. The navicular bone here. The cuneiforms, I will give them all one color, why not? 1, 2, 3, medial, intermediate, lateral. And then the cuboid bone on the lateral side there. And let's do the same here. The cuboid bone rests right here on, remember now we're looking at the bottom of the foot. That was the top of the foot. This is the bottom. And so this is the lateral side. The cuboid is over there. There are 3 cuneiforms. Picture you're looking at the bottom of the foot here. And on the inside there, we have the navicular. And the talus, a little bit of this talus right here. Remember, it's on top of this calcaneus. Now, the movements, I briefly talked about movements of the ankle, dorsiflexion, which this is called the dorsum of the foot. And this is called the plantar surface of the foot. The dorsiflexion would be an upward movement towards the dorsum, the dorsal surface of the foot. Think about a dorsal fin on a dolphin. You know, it's on top. That's the dorsum of the foot. The plantar surface of the foot is down here. So plantar flexion is a downward movement toward the plantar surface of the foot. Inversion of the ankle and foot is in sort of up and in motion. If you were to lift your foot, or you just call it an inward motion of the, or medial motion of the ankle. And eversion is an outer motion of the ankle, or a lateral motion of the ankle. Something to note here, the most common type of ankle sprain is this. It's called an inversion ankle sprain. When you turn your ankle, if this is the top of the foot right here, if you turn this ankle this way, which most people do, you jump and then they land. Basketball players jump and then they land on their ankle, but they catch this part right here. They land right here, and it turns this ankle outward into inversion. They land right on that pinky toe there, and it forces the foot into inversion and the ankle outward, and it sprains this ligament actually right here, and it's called the anterior talofibular ligament. It's very common, and sometimes you might even sprain the calcaneal fibular ligament. These ligaments on the outside of the foot will get sprained. Now, there is such thing as an eversion sprain in the other direction. where your foot gets excessively pushed into eversion and stresses the inside of the ankle or the medial side of the ankle, and you can sprain these ligaments here, the medial ligaments of the ankle. But the most common ankle sprain by far is the inversion ankle sprain right here, where the anterior talofibular ligament is sprained. There is another joint of the ankle. It's called the subteller joint. It's the joint between the calcaneus right here. It's the joint between the calcaneus here and above it the talus. So it's called the subteller joint. And a couple things to note here is this little bump right here, this little tuberosity right here. It's called the Navicular Tubercle or the Navicular tuberosity. It's very prominent. You can feel it on the inside of your foot if you reach down below your lateral or below your medial malleolus. You can feel a bump on the inside of your foot. That's the Navicular Tubercle. Also outside here, this little tuberosity here, this little bump here on the base of the fifth metatarsal. That's you can feel that on the outside of your foot as well. And that's the tuberosity of the fifth metatarsal, and there are muscular and tendon attachments right there. So it's a place of note. And here the posterior view, as you can imagine, if you do an inversion sprain, it would mean that all of this ankle went in this direction and got sprained, and you can see how these lateral ligaments would be strained. And the opposite motion, if you have an eversion sprain, the ankle would be forced in this direction, and it would strain these ligaments, called the deltoid ligaments on the medial side with the medial malleolus. There's also a prominent spot to know on the talus or on the calcaneus called the sustentaculum tali. It is a little prominent portion right here as the calcaneus comes up, and it's a prominent little protrusion right there. And it's important because there are attachments there or grooves there or areas of the prominent place of tendons and ligaments, etc. Sustentaculum tali. This represents the end of the lesson on page 40, Anatomy Coloring Book. I'm Dr. Stephen Harkins.